Now, from CBS 4 News, this is Facing South Florida with Jim DeFede.
Good morning, and welcome to Facing South Florida. When we get through this pandemic, there's going to need to be a conversation about how we treat essential workers, many of whom don't even make a living wage. One group I want to highlight today are farm workers. The fact that there is still fresh produce in our supermarkets is because of the farm workers in places like Homestead, Immokalee, and Belle Glade. And while the rest of the country is reopening and trying to move past this virus, I want to show you this Florida Department of Health map. These are the new hotspots, and as you can see, they include Homestead, Immokalee, and Belle Glade. That's the hidden cost of keeping food on your table. We are now seeing major outbreaks of the virus in these farm worker communities. Here is another chart showing the number of new cases being found every day in Immokalee. Earlier this week, I spoke to Dr. Seth Holmes, a medical doctor who specializes in studying farm worker communities. He has been in Immokalee for a month, and I asked him what concerns him most about this outbreak.
We don't have enough testing here. There's some places like Fort Myers where there's this huge testing, drive up, walk up testing site where you can get tested most every day of the week for several hours a day, and it's free and it's easy to get the results. And here in Immokalee, there was a great effort that the county, the National Guard, the fire department, the sheriff's department, several other groups put together on May 3rd, 4th, and 5th, where every day several hundred people were tested. But unlike some other places, it was only those 3 days that there was a major offering of free tests. It's wonderful that Doctors Without Borders is here. They're doing wonderful work. And it would be great if the county and the state would ramp up testing here so we knew more what's happening, because only if you're doing testing can you do contact tracing. Do people know who should isolate and who should be more concerned? And then we can protect the economy, we can protect the food system, because the other people won't be exposed.
So what are you finding from the test results so far that have come in?
So the test results, even though there aren't very many tests being done, the number of positives is going up fast. So if you take a look at, for example, some of the graphs from cities in March or early April, what we're seeing now in some parts of rural America, including Immokalee, looks like what we were seeing in cities earlier. So what I hear from people on the ground is here in Immokalee that it didn't feel so real until now. It felt like this was something that was happening, maybe in Miami, in Boston, in Seattle, in New York. They were hearing about it on the news, but until maybe the last week or two, people have started to hear about friends or neighbors or coworkers who tested positive or were sick or who died. And it's becoming much more real here. And from some things I've been seeing in the news, it looks like that's happening in other parts of the rural United States too. So in just the tests that I've done in multiple different places where I've been the one testing, the rates that I've seen coming back just on my own tests have been upwards of above 50%. And
so in other words, you're saying that from the testing that you've done, more than half the people you're testing come back positive for COVID-19.
Correct.
Does that surprise you? I mean, that's a pretty dramatic number.
It is a dramatic number. Yes, it does surprise me. And I think anything we can do as a state, as a county, to have more testing, have really great contact tracing. There's an epidemiology group in the county and in the state who do good work, for them to continue that work. And there's groups in the county that are working on where if people can't isolate because they don't have their own housing or they live in a crowded trailer as farm workers, getting them somewhere where they can stay so that the rest of the workers are protected. So we are hearing about community members here in Immokalee who are dying, and we are hearing about people being sick. But I think either this is the early phase of parts of rural America experiencing what urban America experienced earlier, or we just need more tests in order to understand what's really going on.
So seeing the rise that you have in the number of positive cases as a result of the testing, what's been the response from county health officials? Have you seen more resources coming into the community? Are they planning on doing more testing? Is there contact tracing? Are these things being done, or is that still a mystery at this point and we don't know what the future holds?
I haven't heard anything about new testing coming. I would love to hear that. I hope that the county and the state are planning further testing happening here. I know that there's a group of epidemiologists in the county and the state who are working on contact tracing. I don't know the details of that. There are other states where, well, I could...
Let me ask it this way. Let me just do it this way. What needs to happen next? What's the next step that you'd like to see done?
The next step I would love to see done is the state and the county to provide testing regularly, walk-up free testing every day, several days a week, at times when farm workers can come and they're not working. I would love to see active contact tracing so that all the people they lived with or worked in close quarters with get a call and invited to get tested and encouraged to isolate. And I know that the county is working on plans for people to be able to isolate if they can't themselves, like if they live in an overcrowded trailer, for them to have a place to go to isolate for 10 to 14 days in order to protect everyone else. I would love to see that information more public, how that works. It's hard for us on the ground to get people who are testing positive into that system or into those resources, which is really important.
After speaking to Dr. Holmes, I had the chance to talk to Gerardo Reyes Chavez, an organizer with the Coalition of Immokalee Workers, about how people are dealing with the rise in cases.
There is a lot of confusion, and let me elaborate on that. When you have a community whose job is considered essential, but people are not seeing a appropriate response to the threat they are hearing about in terms of how they could protect themselves, you enter into a contradiction. You know, you hear that social distancing is a recommendation. Everybody's talking about what does that mean if you are poor and a farm worker? That means nothing. You cannot socially isolate while going to work. If you are in packing houses, you cannot socially isolate. Where you live overcrowded, transported to work, same thing. So when you take into account the context in which a recommendation like that falls, and then followed by a recommendation of shelter at home, but for everybody except the farm workers, the poorest, the more vulnerable, are expected to continue to do this job. And you know, we find that as a really huge and problematic contradiction when it comes to the expectations that are placed on communities that are left to their own devices, without testing, without personal protective equipment, without resources to be able to isolate and not have to worry about being kicked out or your family being kicked out of the place you are renting. Like, all of those things are at times perhaps more scary than the virus itself, because you have no choice. So yes, the short answer is yes, people are afraid. But when you live in a contradiction like that, when you have to work and provide food for the rest of the country and you don't have what you need, then you get confused, because now people are talking about, you know, the economy must be reopened. People are talking about, you know, all the news that tell you that somehow we are going out, but without necessarily having crafted a plan for communities like Immokalee in a moment in which numbers are spiking. That makes no sense. And those red areas in the map of Florida, when you look at them in the Department of Health, those red dots, Immokalee, Belle Glade, Homestead, agricultural towns, it's no surprise. And that's the sad reality. But what people are forgetting is, if we don't act, if we don't make aggressive testing as soon as possible happen in these communities, we are risking that everybody around these communities is also going to see a spike in numbers, because we work in different industries, in different cities. We travel to every city around us for work. And at the same time, those who continue to work in the last part of the harvesting season continue to provide the food that everybody else needs up north. Those who travel north continue to do that job. So I think that the confusion comes and kicks in, leaving people with a sense of we're not worth for the world. Our lives are not that important. So why do I care about keeping social distancing when I have to travel in the boats with personal protective equipment? There are companies, agricultural companies, that are doing the right thing. They are trying to do their part, but they are limited by the circumstances. We're working with some companies that are doing extra in terms of providing transportation, more buses to try to see people a little bit far away from each other. We have collaborated in making sure that face masks are available for those workers, but again, it is on limited basis. Some companies have ordered things like that, but they have not arrived because it's hard to find them in big amounts. But in general, the response to COVID-19 needs to be more aggressive. Regardless of how the world think or not about what the farm workers are doing, the work that we do, it's fundamentally important for the well-being of everyone, including those who are recovering in big cities like New York, in other cities that are seeing spiking in numbers, other industries where workers are also trying to produce the food in meat packing companies. We have heard of people dying there. We have heard of people dying here from Immokalee also. And those kinds of stories are going to continue to repeat itself as long as we continue to ignore the fact that our immediate future, our survival, is connected. We all, people from the fields, consumers all over the country, and people of conscience need to work together on this.
Late last week, the Department of Health finally acknowledged a problem and said they will be doing more testing in these rural communities. Up next, the mental health toll of the pandemic and the death of a young man who described himself as collateral damage to the virus.